Supervised consumption site is a facility where people can consume pre-obtained drugs under the supervision of healthcare professionals. SCS provides drug users with non-judgmental environment, sterile consumption equipment, services that include social, medical, and mental health care, and education on the potential harm of drug use. The main goals of SCS are to help prevent overdose deaths, reduce the spread of HIV and hepatitis C, facilitate entry into addiction treatment programs, and reduce the strain on emergency medical services. The epidemic of overdose deaths is driven by fentanyl-contaminated drugs. SCS tests pre-obtained drugs for fentanyl and also provide testing for HIV and STD. Opioid crisis. Worldwide, in 2019, 275 million people used drugs at least once. 62 million people used opioids. 36.3 million people suffered from drug use disorders. In Canada, 2016 to 2018, more than 11,000 opioid-related deaths. In the United States, 2017 survey showed that only 29% of respondents supported legalizing safe consumption sites. High level of stigmatizing attitudes toward opioid users are associated with lower support for legalizing SCS. While overdose mortality is higher among men than women, mortality in women has increased lately, especially among indigenous women. Indigenous women are 8.7 times more likely to have fatal overdose than non-indigenous women. Substance use and risk of overdose increased due to fear of institutional scrutiny and fear of losing child custody. Non-punitive policies, including access to safe, non-toxic drug supplies, are critical first steps to decreasing women's overdose risk alongside gender-specific and culturally informed harm reduction responses. Here are some statistics. Canadian supervised consumption sites statistics for 2017 to 2019. 39 sites operated by early 2020. 2 million visits, 3,000 visits per day, 15,000 overdoses and drug-related medical emergencies prevented. At least 35,000 Canadians had sought services provided by SCS. 2/3 of the substance consumed at the site were opioids, fentanyl and heroin, non-opioids, crystal methamphetamine. 30,000 referrals were made to treatment and social services, included medical care, mental health support, and housing services. It is estimated that 1.7 million a year costs to operate one supervised consumption site. While policymakers linger on opening new supervised consumption sites, community activists take the matter into their hands and establish unsanctioned overdose prevention sites. In tents, trailers, vans, and shipping containers within existing communities and housing facilities, where drug users can inject, smoke, and snort drugs under the supervision of trained volunteers and staff. Usually, they are located in undisclosed locations, operate 5 days a week for 6 to 8 hours per day, have a limited capacity to avoid drawing attention, provide sterile syringe and other drug use equipments. Overdose prevention sites are a low-budget intervention that can rapidly be implemented and adapted to different settings. Most sites distribute and dispose of drug equipment and offer information about health and social services, but they do not offer the extensive range of services provided by supervised consumption services like counseling or HIV testing. Services users are drawn to the OPS for the sanctuary and refuge it provides from fear of arrest and exposure to everyday violence and opportunities for social connection. Further steps. The goal is not simply to have drug users supervised, but to optimize the design of supervision to achieve the greatest coverage of at-risk individuals and minimize the cost per overdose prevented. It is essential to evaluate whether supervised consumption sites save more lives per dollar than other available alternatives, such as expanding access to naloxone or opening additional methadone clinics. More evidence is needed to determine the optimal location, staff size, and connection with related services. Public support is needed to fully implement harm reduction strategies to combat the opioid epidemic, which can be attained by changing stigmatizing attitudes toward people who use opioids.